Hello, hello. Welcome back to The Spark is Love. So today we're going to talk about heart health in women. Now, women sometimes present when they're having a heart attack, they present a little bit different from men. And sometimes that makes it easy for them to miss. Okay, so I'm taking a few minutes just to talk about heart health, especially in women. So let's talk about some of the signs of a heart attack in a woman. What are the things that happens, right? She may come in and she may have pain in the chest, pain in the back, right? She may actually have a sharp pain in the upper body. Sometimes it might feel like indigestion or gasping, or you might just wake up feeling sick to your stomach, unusually dizzy, lightheaded. All these are ways that a heart attack may manifest in a woman. Now, something that people think when they think about heart attack is aspirin. And they say, okay, if I have the factors, meaning I have high triglyceride levels, my cholesterol levels are really high, and I have a family history of heart disease, they start taking an aspirin every day. Now, before you start any regimen like this, I would tell you to check with your doctor. Why? Because an aspirin a day might not work for you. Some people, depending on the medications that they're taking or the supplements that they're on, taking an aspirin a day could be very, very detrimental to you. If you are taking an aspirin a day, as directed by your doctor, remember to always check for signs and symptoms of excessive bleeding. Okay, now back to the heart, right? Now, what do you need to know to manage your heart condition? What we are talking about prevention here. What are some of the things you need to avoid? Well, I have a FDA little flyer here. If you want one, feel free to visit their website, but I'm just breaking it down for you very simply. Okay, so three things. You want to limit your food that has salt in it. Something that I really advocate is using fresh seasoning. So from the Caribbean, we have fresh herbs that we grind up so that you don't have to put so much salt and additives to your food, but you don't have to compromise on the flavor. Okay? Look out for the video, it's coming. Second, you want to limit your trans fatty foods. So, what is trans fat? Trans fat is like a complex, or usually it is a synthetic fat. So, it's not just your oils, right? Your oils are fat, like your sunflower oil, your soybean oil. These are just fat. But your trans fat is like your lard or your margarine. And usually you find those in cakes, cookies, donuts, fried chicken. Yes. When that oil is complex and it likes to clog up your arteries. So you want to limit. I ain't saying cut it out. I'm just saying be aware of it so you can limit and cut back slowly in your diet. Okay. And third point I have for you is to cut back on your sugars. So when you look at your label, you might see glucose, fructose, high fructose corn syrup. Yes, the thing might not taste sweet, but it might have sugars, high content of sugars added in. Okay, so be careful. Remember to check your labels. Okay, so what is the correlation between sugar and your heart, right? Well, you want to remember that when the body is finished with all the sugar and it can't use any more sugar, that sugar is stored as ding 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 fat. Okay? So that's my five minute tip for you talking about heart healthy. If you like it, please feel free to let me know what your thoughts are. What's your plan on taking care of your heart? You have a beautiful heart, and I love you for joining. I'll see you next time. Bye.